David fished this river as a boy, but now he's in so much pain he can't even cast a line. He has haemophilia, but was also given HIV and hepatitis C through contaminated blood products in the 1980s. David wants to know why he was given these products made from the untreated blood of thousands of donors at a time when AIDS and hepatitis C were emerging.
Well, I was asking questions not long after I got married, due to the conditions in Africa, which I was hearing which was making headline news at the time. And I was asking the doctors constantly, is our blood product being screened correctly? And the answer was always yes.
But it wasn't being screened. Neither were any haemophiliacs warned of the risks. Nearly every one of them being given the drug was infected.
Well, if I was sceptical, why were they not sceptical? It beggars belief. I can't understand it. I mean, I'm just a layman on the street. I'm relying on their expertise.
The NHS has always argued that this was an accident. Factor VIII was a revolutionary treatment when it was introduced, and the NHS says doctors didn't know enough about AIDS or the new form of hepatitis. But haemophiliacs don't believe them. Today they protested outside the Scottish Parliament to call for a public inquiry. And BBC Scotland has learned that those who have managed to get their medical records, as the Health Minister Malcolm Chisholm promised, have found they're not complete.
I've been fighting for months to get my records, and I've been wrangling with the hospitals, and even now I still have a 4-year gap of records or batch numbers that are missing from treatment at York Hill Hospital. Yeah.
This comes at a critical time. Solicitor Raymond Bradley thinks many patients may have grounds to sue for damages. The missing records could be crucial to the case, as they cover a period when groups of patients could have been developing liver problems.
The medical records would suggest the first abnormal liver function test result that would indicate the initial date of infection for the patient concerned. That is all relevant information that is required in order to run a case in the courts.
The Health Minister has promised to investigate. That's in addition to a criminal investigation which has just begun and legal action against drug suppliers in America. We may be no nearer to a public inquiry, but patients are adamant that one way or another they'll learn the truth. Eleanor Bradford, reporting Scotland, Edinburgh.